Zikhona, just give us an update health-wise. Are those stats still the same? One infection and the Wuhan repatriated still all testing negative?
Certainly, Sally, the 144 all have tested negative, but they still have to remain in quarantine for the duration of the required period. We still have only recorded one case here in Limpopo, but a huge focus in the province has been about churches in particular, bringing people, huge people, and in the province, particularly around the Easter time. But as you know, a lot of people around Easter do go home. I'm going to turn now to Dr. Ramathuba from the Limpopo Health Department, the MEC of Health in the province, who's going to talk to us about how the province is doing with regards to containing that one case. But I want to ask you this. Easter is a busy period all round. It's not just churches that are going to bring people into the province. Are you ready? What are your fears around that time?
Morning, Zikhona, and morning to all your viewers at home, and thank you for visiting us this morning. We must indicate to say yes, the focus is out of the range. It has been an incident-free week, as you have indicated. All of them have tested negative, but we will continue to monitor them until 21 days. Tomorrow it will be 7 days exactly. Yes, our focus, it's starting from tomorrow. You know that there will be a number of funerals in this particular province, and for those funerals we are expecting people from as far as Gauteng to be coming to bury their loved ones, and there are many of our people who are still skeptical despite the fact that we continue to spread the message of social distance. So what we are going to be doing, for instance, now at 11 o'clock, we will be meeting with the House of Traditional Leadership so that we can share with them, because what we have noted is that if you explain to them how this virus spread, they begin to understand why this decision of saying you can't have 100 people in one room, you need to do 1, 2, 3, 4. So we will be doing that, and besides that, at 2 o'clock we'll also be meeting with the MEC for Coxstar, because he has already met with his executive mayors and some of the mayors with the Water Authority, because it's one of the areas that we're looking at. Together with the Department of Community Safety and Transport, we are also working on the issue of, as you will be having, because previously our focus will be on the road safety, but this time around the focus should be on how do you then protect your citizen. You have rightfully said we've got one case, but how do we sustain the one case when, as long as Gauteng cases continue to increase, the risk of Limpopo to be having many cases, it's very huge and high, because most of the people who are working in Gauteng are not actually the citizens of Gauteng. They are coming from our provinces as rural provinces. They are there for job opportunities. They are there to work. So they will be coming back home come this Easter. We just need to find ways and continue with our messages of saying, how do we protect? Because information is power. If we can be able to win in terms of people understanding and become obsessed with hand washing, we know we will be able to win.
Will you be testing at the entry points into the province?
What we will be doing is that mostly at our toll gates, we will be having our officials who will be working there together with those of transport, just to get, because testing, remember, it's a process. People confuse the screening and the testing. So what we'll be doing is to focus on the screening, to be asking people, have you been coughing for the past 14 days? Do you have fever? Are you having other symptoms of upper respiratory tract infection, or even if it's lower one? And have you been in contact with somebody who is a suspect or who has been confirmed to be corona? Are you from abroad? Or you know, all those questions that we are going to be asking. But of course, in terms of other our border post, Bait Bridge, we are going to be strengthening, even though as South Africans, we've become the risk to our Zimbabwean, because there's no single case currently in Zimbabwe, but there are many cases that have been confirmed in South Africa. And we know also people will be moving from Gauteng to their homes in Zimbabwe and also here in Limpopo. So that means that the strategy that we are going to be using would be mainly to protect, because the main problem is that the current infection is on urban areas or on people who can really afford to isolate, to quarantine. Now, Easter holidays can spread it to villages, can spread it to informal settlement, and that's where we're going to have a serious challenges, because we still have challenges of housing, challenges of water, but we are having plans as Executive Council led by the Premier, which was convened. We have put all the MECs and each and every one. It's working on the sector that exactly affect them, and together jointly our plan, we believe it will be able to contain this virus.
Just briefly, MEC, if you can talk to us about this water issue. This thing has several villages in this area. A lot of them are without water or don't have access to reliable water. When are the tankers going to get to the villages?
That's why I'm saying our meeting at 2 o'clock with the MEC for Coxter, who has already, I think it was yesterday, met with all the executive mayors and all municipalities that have got water authority. That will be able to give us a guidance, because as a department we also have our own proposal to say how do they our team of expertise have looked into how do we address this issue of water challenges in the current scenario of having a coronavirus. Just remember, Zikhona, when we had cholera in this province, it was hitting hard, especially on villages and on rural areas. But we were able to overcome it because, as the Department of Health, working with municipalities and the Coxter at that time, we've been able to find ways on how can people protect themselves despite the fact that we do have water challenges. So we also believe even during this particular period, we'll be able to win.
Thank you very much. That's the MEC of Health in Limpopo, Dr. Ramathuba, who's basically saying they do project that the numbers in this province will increase with the influx of people coming from, particularly in Johannesburg, into the province. But they're urging people to just adhere to the rules, stay where you are. And she's also just mentioned, very importantly, that there are talks underway that will be taking place around 2 o'clock this afternoon with regards to taking water to villages and making sure that those people in the villages can keep themselves safe during this time.
Thank you so much. That's Zikhona Chona coming to us from Polokwane in Limpopo.